This is what a case of severe scoliosis looks like before surgery, and this is what it looks like after surgery. This is how we surgically repair scoliosis. We have to surgically break the spine and remodel it and use things like titanium screws and rods to keep it in place. We begin by removing a portion of the joints that connect each vertebrae to each other. By doing this, the spine becomes a lot more mobile and we can put it into the proper alignment. We then have to place special titanium screws into the vertebrae called pedicle screws. These will act as anchor points to be able to attach a rod so that we can rotate and remodel the entire spine. And so after all the screws are in, we take a special rod and we contour it so that we can configure the spine into the proper alignment. We then place these metal extensions on top of the tulips. These extensions give us the leverage to be able to reorient the vertebrae into the proper alignment. We put one on each screw and then we feed the rod through those extenders, and then we eventually push down the rod gradually on each side, alternating between screws. And then this gradually remodels and derotates certain vertebrae to be able to get them into the proper position. We then place a second screw on top of the original screw called a set screw. This goes into the tulip of the pedicle screws to keep the rods attached to the original pedicle screw. And then we take off our extenders, and at this point you have a rod connected to the pedicle screws. We then use a special material to promote bony formation. And by the time the spine is healed, then you'll have one big solid column of bone. And so when we begin the surgery,